6 units of own neg, cross mats, should be ready any minute now. His wife's on the way in, and we've given him another tetanus jab.
Ready for another one?
Stuart. Stuart, do you want to lead on this one?
Corin here was running for the bus when she blacked out and fell over.
Okay.
Momentary loss of consciousness at the scene. Vomited ×1. Vital signs stable. BP 120/70. And apart from a cut to the head, no other injuries.
Good. Corin and Dr. Fields. Remember what happened?
Like someone hit me over the head with a frying pan and I fell.
Gave yourself a nice bump. You squeeze my hand.
I hardly know you.
Tell me you're not going to see her in meetings. Bring her through to resus. Number 2, please. Don't worry, Corin. You're doing just fine. Okay.
Oh, we can't reset your nose till the swelling goes down. And that ankle needs x-raying. Okay?
Yeah. Right.
Hi, I wasn't expecting you yet.
You called for trauma.
Got a young male, RTA, retrograde amnesia.
Short-term memory is not my problem.
No, but I need you to have a look at an ankle once he gets back from x-ray.
Are you saying he hasn't even gone up yet?
No, not yet, I'm afraid, but there are 1 or 2 others you could have a look at.
I bet there are.
Thank you so much for your help.
Got a desiccated kneecap and 3, Louise. What you
Okay, in a minute.
Don't worry, I got this.
One die normal. Would you like anything?
World peace and perfect skin.
Stuart. How's she doing?
She needs a head CT. I don't think the head injury is significant. Apart from that, she's in better shape than me.
All right, I'll leave you to it then.
Okay.
Okay, just breathe on the gas. There you go, as if it never happened.
How was your night?
Yeah, okay, you know, normal. Fun and games and special brew. The plus side, though, I only got spat at once. I need to clear some of these. Bins is all right, Shaw's all right. Lou, any ideas on Mr. Jessup? We could really use the space, kid.
Do you know why I can't walk yet?
No.
Well, then hold your horses.
Now, finally. Are we still doing whip rounds for birthdays or just cards?
Just cards.
Okay. Because it's Stu's big day.
Yeah, I know, said.
Pass it round.
What a shift.
Don't let them kill anyone.
Yeah, I'll do my best.
See you later.
Bye.
Enjoy. See you later, everyone. Good day, yes, Daddy.
Is it epilepsy? No, from too many strobe lights and clubs and stuff.
Unlikely.
You're past all that, I suppose.
Not just yet, thanks. Here, they're expecting. Damon will take you up to CT for your scan. Bastard, Dick. I've been to Ibiza.
Oh, you wild thing. Let me guess, San Antonio.
What's wrong with that?
If you have to ask.
No need to ask if your mouth's too dry, is there?
It's Mrs. Donald.
Yes. How is she?
Corin's upstairs having a scan. We think she's had what's called a subarachnoid hemorrhage. It's a weakness in a blood vessel in the brain which has caused a small bleed.
Well, just how small exactly?
There's no way of knowing. The neurosurgeon can decide if he wants to operate now or at a later date.
Brain hemorrhage. Oh, God.
Look, if she was in any danger, I'd tell you. Corin's upstairs now, wide awake, and answering back every chance she gets.
Proper little smart aleck when she wants to be.
Look, why don't you get yourself a cup of tea, and you can speak to her when the neurosurgeon sees her. Okay?
What kind of pain? Burning, stabbing, throbbing?
It's a pain.
And tell me, do you hear a ringing in your ears when you stick your tongue out?
Yeah, I do.
So he's faking.
Either that or you've developed a hitherto unknown condition, which I doubt. There's an nasty asthmatic in too. Do you want to take a look? Coming. You okay?
Yeah, no problem.
Okay.
Oh, just malingering. Probably hates his job.
But then again, hypochondria can be a sign of depression.
Do you have the bleep number for the duty psychiatrist?
Robert, have your SHOs the faintest idea how to make a diagnosis?
They wouldn't be in A&E if they didn't.
These constant referrals are going up everyone's nose. It's not just orthopedics. Max Facs feel the same, as do pediatrics, and, for all I know, the hospital porters.
Well, I can honestly say I've had no complaints from the porters.
I barely get through my list as it is, without your pretty young things bunging me every case they can't figure out.
Oh, I see. You mean Dr. Mackett, don't you?
You know, some of my patients are having to wait hours past their appointments.
My patients can't make appointments.
And then there's the tone. Everything's urgent.
I have complete faith in all my team, including Dr. Mackett.
Oh, fantastic. Is she another one of your waifs and strays? You giving her one?
No. But I'll put in a word for you if you like.
Don't expect us to carry your team forever.
Annie? Yeah, hold on. Louis? She's busy at the minute. Can you take a message?
This one's urgent.
Yeah.
Well, actually, they all are.
Oh, great. Thanks. Thinking of leaving us already.
What makes you say that?
A locum agency. Returning your call.
Chris? What's on for your husband?
Certainly.
Good. I need a quick chat.
He's not right for her. What does she see in him?
If you really don't want me to, then I won't. Someone has to do it. Chris? Someone has to make sure that Mary gets home okay.
Why does it have to be you?
Because I was driving the car. Because I feel partly responsible.
Only partly.
Oh. She called me, Kristen.
Yeah.
She told me they were discharging her. She asked me what was I meant to say.
How about no?
I couldn't say no.
You're not in a fit state to drive.
I'll take a cab.
Well, if you feel you have to.
I do. I will drop her off and I will go straight home. I've got an essay to finish anyway. Stress fractures in sport. Fitting.
Well, make sure you finished it by tonight. There's a rumour I'll be done by 7.
Oof. Then you have to stay late and heal the sick and raise the dead.
Actually, I'm kind of in the mood for going out and doing something.
You never know your luck.
Call me when you're done. With her. I leave on time tonight. Barring multiple pilots. I really want to go out tonight.
Okay.
Kathy, will you stop doing that?
I've got an itch. Oh, look. I know you don't like mixing personal with work, but can you sign that for Stuart?
Oh, he never said. How old is he?
No idea. And then there's the walking wounded.
Oh, the tedium of miners. Who have we got there? David, just the man.
I'll call back.
Miners. David, think of it as a challenge.
What's he saying?
Did he not like that?
You know, you really should stick it out here. Breaking a contract could look bad on your CV.
Yes, so could killing someone.
We all have off days.
Maybe I'm just not cut out for A&E.
Yeah, well, I reckon you should persevere.
still don't know if there's any bloody tallow shift. Shall I call ortho? But I only refer things when I feel I have to.
Which happens too early and too often. Uses up favours.
Robert, you said so yourself, to always ask if we're not sure.
Then ask me. Oh, Christine. But you should be more sure of yourself by now. I know you feel bad about past mistakes, but that's how we learn. Clinical assessment is what you're here for.
I don't feel bad about past
Trust
mistakes.
your own judgment, Lou. Nothing to be frightened of.
Almost done.
Got the hang of it yet?
Minor wounds? Yeah, I think so, thanks. Think the nurse could do this?
Pressure getting to you.
No. Boredom is.
There's a drug rep to see you, Christine.
Just say no.
Hey, when is she going to see me?
I've already had a look at you.
Yeah, but I want to see a doc. Nurse, get us a drink.
All clear, good.
51-year-old female with serious chest pain, breathing difficulties, ETA 1 minute.
Can you manage on your own? No problem.
Room for one more?
I can't breathe! Oh. This is the wrong place!
Calm down, Leanne. History.
She's a kidney patient with heart disease and hypertension.
Last analysis. Calm down, please, Leanne.
3 days ago, breathless and 2 days ago. Chest pain this morning, relieved by 2 p.m. Pulse 120, BP 190 over 110. Crested both veins, raised JVP, query LVS.
Medication.
Wait here. The usual suspect.
Could be heart failure, could be anything.
This is the wrong place.
You lead, Chris.
On my
Mom.
1, 2, 3.
Come on, love.
Blood in the lateral ventricles and overlying the tensorium. A subarachnoid hemorrhage. Just a small bleed.
Spoken to the neurosurgeon, yeah?
He's on his way as soon as he gets out of theatre. The parents are waiting outside. May as well let them in once he's seen them.
Neuro-obs?
Yeah, and I'll just let her sleep for now.
You all right on this one, Stu?
Yeah?
Do you want me to talk to her?
No? We don't want to spook her for no reason, do we?
Come on, she needs venous access, central line, and oxygen, please.
Terrible. Right, and where do the renal team normally go? No, not that one, not that one. No, what's going through your fistula? What are you trying to do, kill me? Yeah.
Benson. Now we're going to give you some downward things to take the pressure off your heart.
Come on, Leanne.
Come on, Leanne, they can hear you from the roof garden. She'll need a nitrate infusion.
Into sorbet dinitrate.
Now, Leanne. That should do it. Now, Leanne.
Come on, Leanne, we're going to put in the central line to measure your CTC.
Your dad are outside. Just waiting on someone from the neurosurgeon and you can see him.
Nice one. Dad's clucking around, is he?
Please, Leanne, just 1 second, 1 second. Not too much.
What's wrong with her?
Fossil on.
Thank
Should
you.
be all right.
She looks well rough. Just as well I can't see myself.
You look fine.
Leanne Smith, she's
Cigarette?
one of yours. Is that the best? Hang on. Mike, can we live at 7:30?
No.
No deal. We need a bed for her this afternoon.
Leanne,
Thanks.
we'll have to take some blood for your gases, but that, I promise you, is the final need.
It'll the drip tissues.
Yeah, till the drip tissues.
If they're in.
You ever wonder what happens to the ones who don't make it?
Who's the patient?
No. Doctors.
Leanne's not had a coronary read. She's LVF from the little acidotic. Shall I give her some bicarb?
Yeah, save 50 mils of 8.4%.
Sure.
You think she'd be hardened to it by now?
She's used to the way they do it up in renal. Deviate from the drill and she thinks you're trying to kill her.
Professional patient.
Yeah, never getting any better.
And at her age, no chance of a new kidney. Look, I need 5 minutes, okay?
Yeah, sure.
Mike, can you get in here, please?
The pupils are blown.
It is? Yeah, no, that's fine. Listen, can you get in here beforehand? Yeah, you can, yeah.
Dr. Phelan.
Nowhere to hide.
Happy birthday.
Hey, how do you know? Yeah, okay, whenever. Bye.
Open it up.
What is it? Hey, guys. You shouldn't have. Really?
What are you doing tonight?
Playing Happy Families. Dinner around my brother's. So the sports car's outside, yeah?
Oh, yeah. That cost a whole pound.
Not a penny more.
Stew. For you.
Mike, can we run through some manifold now, please? Pupils fixed and dilated, but
She's bled again.
Yeah, big time.
Finish your lunch, Stu. We've got this.
Do you want me to speak to her parents?
Don't worry.
Yeah, I'll hold.
I'll do it.
Couldn't beat him again for me, though, could you? Thanks.
Stuart, there was nothing we could do.
I should have been here.
There is no way you could have known this was going to happen.
But it did happen. And I wasn't here.
Stuart, you've done nothing wrong. You didn't miss anything. Now go and finish your lunch.
Not a pretty sight, is he?
Mr. Raven, your GP's letter says you've been like this for months. Why haven't you been to see us earlier?
Well, the way he goes on, you'd swear my legs were going to drop off.
Have you been in a fall recently?
No.
Been attacked?
Eh?
Been in a fight?
His fighting days are long over.
Stuart! Stuart, someone outside to see you.
Who?
Your sister-in-law, Denise. And Carrie. Got an unexplained bruising in here. A lot of it about.
Must hurt.
No. Yeah, well, just a little.
Right. There's possibly a broken finger. And laceration there.
What, my war wound? Look, any chance you could just strap it up right away? I mean, I really ought to be getting back to the garage.
No, I want to get you to X-ray first.
Right, well, you're the doctor.
Harry made this for you. She'll be in bed later. Happy birthday to Uncle Stuart.
Happy birthday, Uncle Stuart.
It's Carrie, that's lovely, isn't it, eh?
Craig helped with it.
Right. Denise, what happened the other day? He hit you, didn't he? I've got to know.
Why? It's no big deal. We had a row. It happens. We'll get over it. I'm a big girl now. Don't worry about me. You can't just blame Craig. I wind him up sometimes. I know I do.
Jesus, Denise, listen to yourself.
Listen. It's a really hard time for Craig at the moment. And then you come back, and you're the big, successful doctor.
So it's my fault?
It's nobody's fault. He slapped me. He's sorry. And he feels terrible.
It's happened before. It has, hasn't it? Denise, if you're worried about money, I can help. Whatever you need.
I don't need rescuing.
I'm trying to help you.
I know. Just leave it. Craig's knocking off early tonight. In your honour. So don't be late. Gotta go.
I want to help you.
Yeah. I'll see you tonight, yeah?
Thanks, Tom.
If you just let go of her hand for a minute.
Something has to be causing this. Are you on any medication?
I had an operation last year.
For a stomach ulcer.
Duodenal. Surgeon had never seen one that size.
Well, she would say that, wouldn't she? Been taking pills ever since. Can't eat much else, can you, Frank?
Bread and milk. Do you know, the pills taste better.
Could just be that your blood's not clotting the way it should. I'm going to need to take some blood. Now, this will only hurt a little bit.
Don't worry, lad. I won't faint on you.
His mother was the same, crippled with her varicose veins. But it was the fags that killed her in the end.
I haven't smoked since 1962. She won't have them in the house.
Right. Don't go away.
Hello? Excuse me. I'm still here.
I'll be with you in a minute.
Do you want me to clean him up?
No, I need to make a call first. Trauma Reg? Dr. McInerney. That's right, me again. I've got a patient with a blast injury. The x-rays are clear. No, I think you do need to see him. Hello? Hello?
Yeah, whenever's good for you.
I won't be long. Fino and that's nothing ortho.
Oh, I don't believe this.
Kenny, it's me. Will you call me as soon as... Look, I will be out of here by 7 at the latest. So why don't you meet me and we'll head on out. You can get me pissed and shag me senseless.
Come on.
Oh, Danny! Oh. It's with the mask. You're thinking of climbing Everest.
They're keeping me in. Better stay at your dad's tonight.
But I'll have his girlfriend there again.
Good. She could make you your tea. Go on, Danny, back to school. You can't skip classes every time I'm in here.
What's Colin doing back in resource? We're waiting for a bed at County, Stuart.
Waiting for a bed? She needs to be in intensive.
Yeah. No, that's no good. Okay, well, thanks for letting me know.
Doctor, we count to your call.
Stuart. You going somewhere?
Freeing up a bed in ITU.
And what do you think they'll do? Discharge someone?
Maybe.
Intensive care is generally full for a reason, Stuart. Look, she doesn't need grand gestures. She needs a bed. And we'll find her one. Somewhere. Come on.
Checkpoint Charlie. Agents about to cross into enemy territory.
What now?
My patient, Mr. Austin.
I've already told you just so.
But it was an industrial
Today,
accident.
preferably. Have you met Dr. Macken? Well, don't worry, you will.
And given the nature of the ischemic wound.
Oh, yes. The life-threatening scratch.
Don't you think we ought to wait before primary closure?
If you know so much, why ask me?
I really think someone should take a look.
Have it your way. 10 minutes.
Normal?
Normal.
Bollocks. the number for social services, could you? I think she might be whacking him.
I'll see what I can do.
And I need a number for toxicology.
And to think they call it minors.
Your blood tests are back, and they're all clear.
That's good news, isn't this?
Rita, do you want to take some air? Have a cup of tea.
Just shout if you need me.
Dare you say that? That woman is a bloody saint.
Mr. Elliott's on his way down from orthopedics, and he's on one.
Sorry, love. How do I get back to Miners?
Through the double doors and on your left. You can't miss it. Are you all right, love?
No. You try to keep the place nice.
We do, yeah. Yvonne, do you want a hand? No, I'm fine.
Must be a thankless calling. I mean, they've no idea.
Are you a nurse?
Good as. Home nursing. No tea breaks, no time off for good behaviour. My Frank hasn't been the same since they removed his ulcer, duodenal.
Well, he's lucky to have you.
That's what the surgeon said. Nice girl, unmarried. But that's careers for you. And mind you, she's quite old-fashioned herself. Swears by milk puddings of all things.
Well, they give the stomach lining a rest.
He goes on sometimes. Says he'd kill for chicken Kiev and a fruit salad. Feed them milk puddings, the lady said. Can't stand them myself.
How long ago was this?
13 months and counting. And after serving them day in and day out, I can tell you, I wouldn't mind serving something else.
Yvonne, can you give me 5?
Oh, I better get back to the invalid.
You're a one-woman waiting list, aren't you?
It's not as straightforward as that. You may have some debris in the cut.
Look, it's very straightforward from where I'm standing. But you're holding everyone up. Look, he's been here for over an hour. They've been here since well before lunch. And I have been standing here for over 4 bloody hours! Look, get me out of here now! Or I will have you up in court for negligence!
Hello. Excuse us. Everything okay?
I'm waiting for orthopedics.
Oh, no. Are they on their way?
Look, I know what you're thinking, but this really needs to be looked at. I'm not passing
Do you
the
want
buck
me to
here.
speak to them?
No, I can do it.
Good. Well, then calm your patience down before you have a bloody riot on your hands.
Your heart's having a bit of a bad day.
Again.
Well, maybe we just need to play around with your pills a bit.
The worst bit's knowing that Danny saw me like that.
Easy, young. It won't be the last time. You'll get over it.
It's never ending. It never gets any better. Oh.
Yeah, no one said this life was going to be easy. Stop fighting. Take what you can get.
Is that what you do?
That's what I should do.
Mr. Kingsford or Dr. Gregson to the minor treatment area.
David, I need to talk to you.
Later.
Look, could you just listen to me for just 1 minute?
Just give me 2 seconds to work out what's wrong with this guy.
Frank, his name's Frank. He hasn't eaten fruit, veg, or protein in 13 months.
My heart's bleeding.
Yeah, well, his gums are bleeding. He's clearly vitamin deficient.
Hi. There's, I've got this, old man I'd like your opinion on.
David thinks the patient's suffering from malnutrition. Scurvy, to be specific. Don't you, David?
Could be.
Scurvy. That's a new one.
This is a joke. Haven't they come up with anything?
That is what I'm trying... Yeah? Yeah, still holding.
Stuart, give it a rest. It's not Judy's fault.
I never said it was, did I?
Come here. What's wrong? Come on, what's wrong?
I'm fine. Let's leave it.
Stuart, what's the problem?
My brother, it's his wife. She wasn't mugged. And I don't know what to do.
Well, I'm sorry about that. I really am. But while you're here, you do your job.
What?
Shouting at me or biting Judy's head off is not going to make any difference.
So I'm supposed to just carry on like everything's fine?
While you're here, yeah.
Well, thanks, mate. You've been a big help.
Stuart,
Shit happens. Get used to it. My wife's left me. Leanne's kidney's packed up. Man City don't have a defense. Come on. Make a difference.
Reminds me of a teacher we had at school. Mr. Townsend. Right bastard. Just prowl around corridors looking for victims. Bang your head with a tin cup.
Left you mentally scarred, did he?
Excuse me. Mr. Elliot, thank you for coming. The patient's still here.
You don't say.
Andy?
A blast injury.
That's right. He was leaning on a tyre when the tyre exploded.
May I?
Mr. Elliot, I have to tell you, if you want to close the wound, that's up to you. But I'm not prepared to.
Go on.
There is a danger, I think, that the debris in the cut could lead to...
Fever, purulent discharge, infection in the flexor tendon sheath.
Excuse me?
Run that by me again.
Stitch you up now, and in 48 hours, you'd be back. With a hand the size of a rugby ball, oozing with pus, begging me to amputate. Not pleasant. Count yourself lucky you were seen by this young woman. Admit the man, take him up to the ward.
You'll be a new man in no time, Mr. Raymond.
Yeah, that's what they said last time.
Oh, well, we've made an appointment with a dietitian for you. In the meantime, you drink plenty of fruit juices and plenty of fluids, okay? Have a word with his wife about the wonders of vitamins. Bearing in mind that metaphor is not her strong point. Absolutely. Good diagnosis. Kathy spotted it, didn't she?
Yeah, so.
Yes, well, you should have said so at the start. Not a competition, you know.
You've got quite a formidable reputation.
Good. But I'll let you into a little secret. I'm only a pussycat. Thank you. I think you're very good.
Thank you.
Have you ever considered moving upstairs to orthopedics?
Okay, hang on. Sorry to interrupt, Robert. I've got Doncaster on the phone. Said they might have a bed available in a few hours, but they can't be sure. What do you want me to do?
Tell them not to worry about the bed. She's too far gone.
No, thanks.
I'd like to tell the parents. Leave it to someone with some experience, Stuart.
I said I'll do it. As you know, earlier this afternoon, Colin had a second hemorrhage. A massive one.
You said she was going to be fine.
I'm so sorry. We had no way of knowing. She was just very unlucky.
She, brain damaged?
How bad is it?
I've spoken to the neurosurgeon, and I'm afraid it is very bad indeed. Corin's on a ventilator, but I have to tell you, it's unlikely she'll regain consciousness. Her brain's closing down. We all think That is, the doctors here all think she's dying.
She's only 19.
What if we went private?
Well, that wouldn't help. Would it?
Did you ever discuss organ donation with Corinne?
I can't think about that. I can't think about anything.
She was carrying a donor card, but we need your consent. If you do give your consent for her organs to be donated, then we'll have to keep her on a ventilator till they can be removed.
Can't you do that afterwards?
Afraid not. They need a beating heart.
No.
It really is unlikely she'll regain.
Then take her off the ventilator. Now!
Kenny, you must be home by now. Will you pick up the phone?
You blind well, it's stupid. I know.
Come on, Kenny, it's 5 o'clock. Where are you?
So you talk down to me, you little slag. I pay your wages.
One more word out of you, mate, and I'll have you thrown out.
You've got to see me. I'm entitled.
Not while you're threatening me, I don't. There's an A&E at Millingford General, and minicab will get you there in no time.
You're having me on.
Look, you just sit down there quietly till somebody sees you and knock that nose into shape yourself. What will it be?
Well, that told the little bastard.
Yes, I suppose it did.
Elliot seduced you into joining orthopedics, yeah?
Not yet. But it was nice to be asked.
No more whinging from him, then. Excellent.
Kathy. How's your eczema?
Ooh, you silver-tongued charmer. It's not eczema. It's daylight deprivation.
Should get out more.
I'll bear that in mind, Doctor.
I wasn't actually speaking as a doctor. My kids are dragging me to some five-a-side thing on Saturday, and I was wondering if, you know... Do you like football?
Treating you boys and tits, I think.
Okay.
Somebody wants you.
Yeah. To the end.
At least think about it. Corinne's a perfect donor, and it's what she wanted.
You were well, did you?
Hi. I'll see you up in Reed a little bit. I'll just get you ready, eh?
Right, you are.
She's tired, isn't she?
And she was carrying a donor card.
God, I hate mirrors.
Mike's got a bit of a thing for you, hasn't he?
Oh, you know. One minute he does, the next he doesn't. Too much like hard work.
It's a shame.
Yeah, tell me about it.
Still, if you're not bothered, leave it.
I don't know. I can barely remember the last time I had a shag.
I know what you mean.
Or fighting them all.
Sometimes I let them win.
Do you never get lonely being on your own?
feel sometimes. It's better than being in a crap relationship.
Oh, like Christine and Kenny.
Can I try?
Hope the delectable Miss Marriott likes it.
It's for you, Kath.
She was carrying a donor card. Christ knows, it's too late for me now. But there's plenty of others that she could help. She wanted to do the right thing. She wanted to do the right thing.
She has got a name. It's Corinne. She spends half of her life on the phone and then the other half on the dance floor at some club or other. She's got an overdraft and a boyfriend that I don't like. And she's breaking my heart.
I'm really very sorry.
Don't be too hard on yourself, Niamh. It was our morphine talking.
No, it was me.
Just let it go, okay?
I expect an apology.
Since when was it hospital policy to cause a scene at a deathbed?
When would have been a good time to ask? Half an hour? An hour? I was trying to help, trying to make a difference.
Who to, yourself?
Corinne was carrying a donor card. That could have helped a lot of people, saved some lives.
Corinne's parents are still alive, Stuart, or hadn't you noticed? They don't need you treating their daughter like some freezer full of spare parts.
Well, lucky you've managed to stay so far above it, aren't we?
We're here for the patients, Stuart. They're not here to make us feel better. What are you trying to do, kill your career stone dead?
Starting brainstem death tests at 1950.
That's it.
Would you like a few minutes?
Let's get it over with.
Kenny, it's 7:30. Where are you?
Well, just forget it then.
Finally escaped from miners and I'm too knackered to think straight.
Anything nice, Stu?
Oh, just round Brothers for something to eat, mate.
So, you're off to play Happy Families with Craig, eh? Or are you going to kick his head in?
I'm going there for a meal.
Huh? Domestic violence. You rang the police?
domestic liaison officer?
I spoke to Denise. It's no big deal.
No, Craig's just a big cuddly teddy bear, doesn't know his own straight.
Look, it's nothing to do with you.
Yeah. Brothers at the front door.
Can't come tonight. That'll work. Just found out there's no one else to cover.
Fair enough. Some birthday, huh?
Yeah. What can you do?
Another time, then?
Yeah.
Okay, before you go, it's lottery time.
Ah, come on, Teddy.
Cough it up. This could be your Richie's college fund.
Kathy, will you stop doing that,
Yeah,
please?
I know, it's the latex, the bloody latex. You know, I can deal with the psychotics and the drunks, but these things would drive me out of nursing. Sorry, what's so funny?
You're allergic to rubber. Figures.
A sugar boost. Keep you awake. It's another long, dark night at the zoo.
Thanks.
You're welcome.
Oh, Christine, thanks. Purify.
Come on, you.
Oh, Kath. Vol and Judy down at the Blue Post. Get them tossers from E&T.
Oh, it's all karaoke and happy hours, that place. Get enough of that here.
Now, go on. I deserve a drink. Mike, how about it?
I can't tonight. I've got to look after the kids.
Go on, then, you twist my arm. Let's get wrecked. Night, Mike.
My troops.
How come no one helps me through the night?
Do you really want me to answer that?
Uncle Terry's back, everybody. Let's get ready for mayhem.
More accidents are just waiting to happen in and out of St Victor's next Monday, 9 o'clock, HTV.